All right, everybody, welcome back to the To Be Fit podcast. My name is Brian Bott. I'm your host. Today, I'm joined by Dr. Tamra Wroblesky, owner of Inner Dynamics Physical Therapy, specializing in pelvic health. Tamra, welcome to the show.
Thanks for having me.
So first and foremost, as a brief introduction, I call Tamra the Dos Equis woman. She's the most interesting woman in the world. Every time I check in with her, she is on a different mountain or a different place, hiking and climbing. So tell me a little bit about that. I know in your office you have this huge map of all the places that you've summited. Is that the correct way to say it? Or all the peaks that you've climbed? So tell me about that. How did you get into those things?
I'm an endurance athlete. I like climbing and hiking for long periods of time and getting to the top and coming back down. It gives me something to wake up for in the morning, something to train for. So I'm a high pointer. I've been doing state high points for maybe 10 years now, and then moving on to country high points too. So my goal is to do all 50 state high points. I'm only 2 away. And then
What 2 states?
Alaska. So I got to,
that one sounds like it would be hard. Alaska sounds like it would be tricky.
I was 3 hours away and then I had to turn around. So that's the biggest thing that gets me up in the morning, to be able to go back and do that one. And then Utah, which is where I'm going to go celebrate with my friends. It's not a very hard one. And then I think I'll be the 35th woman to do it in the US. And then I'm up to 30 country high points, hopefully soon to be 31. I'm going to Bolivia in a couple of weeks to climb the highest point there. And then I'm hoping to get about 100 country high points before I die.
How long does something like that take? Is it like a few hours, a few days, or does it vary, obviously?
Bolivia, we're going down for 9 days, and that's kind of pushing it, but I don't have a lot of time to take away from patients. So we'll acclimatize for the first couple of days. We'll do like a mini hike, and then it'll be like a 4-day expedition there. Some country high points just take a day. It really just depends. State of Florida, when you go do the high point, you walk like 20 feet to the highest point, and then you got it.
And then for further clarity, Tamra is not staying at the Ritz-Carlton in these places either. I think I followed one trip where it was like you had to like hire random people to drive you to a point, and it was all, so you are you're experienced. Yeah, you're experienced. Is that what they call it? Is that
I'm
like a term?
Bag, yeah. Yeah, I'm very professional now, but we sleep in the car. We go on 2 hours of sleep. We eat 4-day-old food, and that's just the way I like it.
Awesome.
Yeah.
Not a ton of people are familiar with a physical therapist who specializes in pelvic health. I don't think that most might even know what that entails. So briefly, like just catch everybody up. What does it mean to be a physical therapist that specializes in pelvic health? How did you get there? What was your own journey to kind of leading you into that specialty?
First of all, thank you for having me here. I'm always excited to talk about pelvic health because, like you said, not a lot of people know exactly what that means. I think now with the internet, and more access to information, people are starting to see things about your pelvic floor, but they don't know exactly who they should talk to about what that is. So pelvic health basically is dealing with the center of your body, from your rib cage down to your pelvis. It's not just about your pelvic floor, it's about your groin, your low back, your inner thighs, your glutes, and it's something that we check, especially with women who are going through pregnancy and after delivery, but it's also something we check with children who have bedwetting or constipation issues, and with older men who have prostatectomy, prostate cancer, gynecological cancers, and just athletes in general who will have groin pain, low back pain, things like that. So, I consider myself just a regular physical therapist. I'm just looking at these muscles that a lot of people forgot. So some of these muscles are inside our body, and not a lot of physical therapists are educated to actually examine those and see what they are.
Okay, great. So, that's how I ended up, for background about how I ended up in your office. My background was in powerlifting, a history of squatting heavier weights with a really, really wide stance. And never probably doing any of the minor exercises or mobility work that I should have been doing to kind of keep those areas healthy. And I basically got to a point where my hips were so jacked up that like just walking and everyday kind of movements, I could go to the gym and work out, do upper body stuff, but the amount of pain that I was having hip wise and things like that got to a point where I needed some help. And, you work specifically with the weightlifting and powerlifting community, right?
Yes. So I'm the consultant for USA Weightlifting, and I've done a lot of their coaching videos online, and I work with a lot of their athletes because it's a sport that needs probably the best pelvic health more than any other sport out there, because you're lifting so much weight overhead and your whole body is a pressure system. So when you're loading that much on your pelvis, on your center core, you need everything to be working efficiently. And a lot of times those athletes are really lacking in mobility, and it doesn't have to be an incredible amount, but just a little bit. When you compound that amount of weight on top of it, then things start to fall apart and things start to happen. So I love working with those athletes and kind of dialing in their pelvic health. And you were spot on talking about the hips. The pelvis and the hips go, they match right together. So if you are lacking hip mobility, that's going to affect your pelvis. If you're lacking abdominal mobility, thoracic mobility, that's going to affect your pelvis. So it's really just the center of your body. And really that needs to be perfect before you deal with anything in the extremities, because that's the center of everything that we do.
I know your background, you and I have spoke before, but just to kind of catch everybody else up, how did you get into this area of specializing in pelvic health? What's your own story? What led you to kind of dig deeper into this area and figure out that maybe more people needed more help in this realm?
I think most pelvic health therapists, we have just a special connection to it. And so I dealt with a lot of pelvic pain growing up. I was a tennis player in college, and all of a sudden, out of the blue, I just started having severe pelvic pain. And for me, that just first presented as pain with sex. And I was maybe 18, 19 years old, and no one could tell me what was going on. I went to gynecologist, I went to specialists, I went to the ER, and no one could give me any answers. So fast forward a couple of years, I finally went to a pelvic physical therapist out in San Francisco, who finally gave me some answers and took a look at my hips. Now, tennis is a lot of asymmetrical rotation. And, we're going to talk more about this during this podcast, but in your pelvis, you actually have a lot of hip rotators that sit right next to your pelvic floor. So what probably should have been a very easy fix, what probably was just a strain of a hip rotator because of a rotational sport, became this whole long, painful journey for me. With no one giving me the right answers. So I finally met someone who gave me some information, flew home, had a variety of different surgeries. I've been through 2 hip surgeries, a groin surgery, 2 pelvic surgeries at this point. And then I realized I wanted to change my career and actually go back for this, because again, it's really simple information that we're going to talk about today. And if I had known all of that when I was 18, it would have saved me probably 8 to 10 years of pain. So that's what I want to be for people. I want to kind of put 2 and 2 together and give them that information.
So you had to really kind of do a lot of work on your own then, right? To kind of search that out, because, for reference, where you were here at TCNJ in New Jersey, how did you go about finding someone in San Francisco? It's obviously at that point, it probably wasn't as widespread or easy to find information as it is now.
No, it wasn't at all. And so I kept quiet about it for a long time. And then I think towards my senior year, I got fed up with it. I got fed up with really keeping it a secret, because when you talk about pelvic health, it's really uncomfortable issues that people don't want to discuss. People don't want to talk about, pain with sex. They don't want to talk about problems with their bladder, problems with their stool. So it's just not something people like to talk about. So I started a blog my senior year, and it was one of the first health blogs about chronic pain, pelvic pain. And then I met all of these women on that, and someone pointed me to go to this PT out in San Francisco. So on a whim, my mom and I flew out there, because I was actually scheduled for a really invasive pelvic surgery that I'm really glad that I didn't go through, because I didn't need it. And I went out there, had a full orthopedic exam, which was really important, and then came home and then started to learn a lot more about the pelvis and what I could do. But, I even went to some really fancy pelvic PTs in the city, and pelvic PTs, a lot of times we do internal work, so we can work on those muscles manually, kind of like you would any other muscle of the body. But even they didn't look at me from a whole body perspective and didn't give me the full fix. And it wasn't until I actually took my extracurricular or my classes to go to PT school, and then started PT school, that I realized that you have to strengthen the whole body if you want to really fix a problem. So we're talking 15 years later, did I finally figure out what I should really do to take care of my body?
Yeah. And I think that's super important for anybody who's considering who they're going to work with from a physical therapy standpoint or a coaching standpoint is, I think, I'll default to you, but I think you would agree that regardless of what your injury is, if there's not a process that looks at how you move and what your daily activities are from a whole body perspective, you're most likely going to be missing out on, some valuable information, right? You weren't someone that was having pelvic pain that was just sitting on the couch doing nothing, right? You were a collegiate tennis player in a sport that requires rotation. I would guess more to one direction than the other. I'm sure you'd like it to be balanced, but it probably wasn't. And if no one's asking those questions, it's hard to get the right answers.
Right. And if you're going to a pelvic PT who all they're doing is doing internal manual work, trying to release one muscle, that's really not going to help. That's putting a Band-Aid on the problem. You need to look at someone who's going to look at your whole entire body and say, hey, you need to be doing these hip mobility exercises, these hip strengthening exercises so that we can take pressure off here. I mean, your whole body is a machine. You got to treat it as such. You can't just, just work on one muscle and think that you're going to fix the whole problem.
Yeah. So like putting it in words, or how I try to describe it, because when I'm trying to convince your services, or maybe talk to a client who's experiencing an issue and trying to explain to them why that method might not be practical, I just try to explain them in this way: is like, hey, these are small muscles that we're talking about, right? And while releasing them or doing some manual therapy is a piece of that, we need to figure out why are they doing the work of these bigger muscles that should be handling, or why are they getting overworked? And that's the piece that I think gets neglected the most. Is like, you can go, and there's a difference between getting pain or symptom relief and then separating that out so that the pain and the symptoms don't continue to come back. Walk me through that a little bit. Like, when in your evaluation process or treatment, how are we separating out, hey, here are the things that we might need to do to get rid of the pain in this right now. And then here's what we might need to do for the next 6 to 8 weeks or forever to make sure that we don't have this pain and symptoms moving forward.
Right. So when I have a patient come in, I get most of my information just sitting and talking to them for probably at least 30 minutes to figure out what was the mechanism of injury, what are their movement practices, what did they do growing up, what sports did they play, how did they spend their time with their bodies, what they're doing now, what do they do for work, how do they sit, their biomechanics, and then coming up with a plan. So yes, some of that is we have to get the pain to decrease if they're coming in with severe pain. And there's so many different manual techniques we can use. Some of them are internal techniques that we can do to work on pelvic floor, hip muscles, muscles surrounding the bladder, the rectum, whatever. But from there, I have to figure out, why did this happen to begin with? And I would argue that the pelvic muscles tend to be very secondary, right? So they're very small muscles that sit at the very bottom of our body, and they're like a sling that goes from front to back, and they're usually in trouble because of something else. Very rarely do I see injury to the pelvic floor, and when I do, it's usually from childbirth, or gynecological cancers or surgery. So something invasive like that. So very rarely is an actual injury to them. Or I had a gymnast one time who landed on the platform right there. So it's usually a pressure problem. And that's why I end up working with a lot of weightlifters. So it's usually pressure from above, from the abdomen. So I actually see a lot of patients who have had a history of abdominal scars, whether that be women who have had C-sections, whether that be people who've had their gallbladder out. With the men, a lot of times it's hernia surgeries, even when they're a kid, that can restrict movement, increase pressure. And then that over time builds up. And then all of a sudden you start getting pelvic symptoms. And I see that a lot, where people will be feeling fine. And then over the course of 20, 25 years of those restricted movement practices, that adds up. And then all of a sudden, out of the blue, these weird symptoms happen that really freak people out. But it's really been built up over time, and it didn't start there. It was from somewhere else. So I have to figure out where that is. So pressure from above is a big one. And then also mobility from below. So hip mobility is huge. And men actually have narrower hips than women. So they, more than anyone, need a lot more hip mobility. And I see a lot of problems with men, whether it be prostate related or just in general, like groin or pelvic pain, because they don't have enough space in their pelvis like women do.
So just to kind of recap that, I mean, most of these things then are coming from chronic related issues. They're not really coming from traumatic events, right? It's never, I just stepped the wrong way and then I started having this pelvic pain, or, it's, hey, I've had this restriction either in mobility or how I'm choosing to stabilize over a long period of time. And then, one day, hey, I'm starting to have these symptoms and I'm not really sure kind of where they're coming from.
Yeah. But it's going to feel like it was all of a sudden out of a blue. They have either excruciating pain, or all of a sudden they're starting to have bladder urgency, or rectal pain, things like that. It will appear almost out of nowhere, but it's been building up for a long time.
Yeah. So let's dive into that a little bit. Like how as a regular person who's working out or training, or doing recreational fitness, maybe they play tennis or pickleball or something on the weekend. What are some symptoms that they, not to freak everybody out with Googling their symptoms and thinking that they have some major problem, but it's what we're talking about. What are some things that they should kind of be aware of? Like what's normal and what's not normal?
That's a great question. So in your pelvis, you have your bladder, and normal bladder symptoms are you should be able to hold your urine for 2 to 3 hours, depending on what you're drinking. You should not be getting up in the middle of the night to urinate. When you do urinate, it should be like a nice steady stream that comes out, and there should be no dribbling at the end. You shouldn't feel like you still have to go. You should be counting for at least 10 to 15 seconds when you do go. I have some people who go very urgently every 30 minutes, every hour, whenever they see a bathroom. And then another cool thing to look at when you're an athlete is to see which way your stream goes. It's a question I ask a lot of my patients who come in.
For the record, when you asked me that, I was like, I don't know. I could check, but I'm not really sure. I never really paid attention.
Yeah,
My God.
I did this veteran retreat once with a bunch of 50, high-powered veterans, and I had them all checking to see which way their stream went by the end of the night. And it's really good, because if it's going to the right, going to the left, you can actually tell which side of your pelvis might be a little bit tight, restricted. So it's just good information. So again, your stream should be going straight down in the toilet, not spraying anywhere. That's signs of a healthy bladder. And then bowel habits. Signs of a healthy bowel is that you should be going 1 to 2 times a day. You should be fully evacuating your stool. It should look like a log. It shouldn't look like M&Ms. It shouldn't look like diarrhea. Most of the people I work with end up dealing with severe constipation, and that's a huge problem. And when we talked about, pelvic floor issues happen because of pressure, most of it happens, I'd say, because of bowel issues. Most of the people I treat right now, I'd say 80% are struggling with constipation. And they didn't even know that they were constipated. So they're like, yeah, I go like maybe once a day, maybe every other day, but they're not fully evacuating. And that's a huge problem, because when you look at your colon, your descending colon sits on the left side of your body. And so that can be almost, 4 to even 6 pounds of added weight that are just sitting on that left side. And I end up working with, again, a ton of athletes who have this weird left-sided hip pain, and they go to the chiropractor, they get it, dry needled, and they just can't shake it. And all they needed was to regulate their bowels. I end up doing, abdominal massage, and we kind of tweak what's going on and causing that restriction in the first place. And all of a sudden their hip pain goes away. I had 6 people like that at a workshop once. All 6 people had left hip pain, and then they all needed just abdominal massage, like stretching, and all of a sudden left hip pain went away. So you got to look at other places to see what might be causing it.
And to even further your point, like this is why everything matters. Like if you're eating like crap, if you're not getting enough fiber, if you're not doing these things, and again, there's plenty of reasons someone might be dealing with those symptoms, but everything matters, right? Then why should I eat more broccoli? Well, who knows? Maybe you have left hip pain, right?
Yeah, right.
Like, so maybe you need some more vegetables, right? So, and the point that you brought up earlier, that is like, this isn't the most comfortable thing for people to talk about. It's not like when people come in and they're coming to one of our gyms and they're looking to get started, that they're just going to offer up like, yeah, I just wanted to go over like I pee myself all the time and it definitely goes to the right. And I just been constipated for the last year. Right. So what if anything can coaches do to maybe help better understand or ask these questions to clients in a way that's not super intimidating, or because it's uncomfortable for both, right? I don't want to go up to a stranger and ask those questions, even though it's super important. And then, they're not going to be super willing to just offer that up out of the blue. How do you, any tips or suggestions on how to kind of have that conversation?
Yeah. When you're a coach, I think talking about bladder and bowel should be a pretty comfortable conversation, because it's a good sign of health. Like, you can just get into it by talking about how much water they drink, and then kind of going over bathroom techniques with that. And then just, I think gut health is very, in right now, and just talking about that, making sure that they're going to the bathroom every day. And as a coach, I think it's always good to lead by example and just talk about yourself and say, hey, I didn't think any of this mattered. I know this seems really crazy, but I know someone, she's a pelvic health therapist, and she's kind of opened up my eyes how pelvic health really, influences your back, your groin, and your hip health. So these are like questions now we're starting to ask as screening questions to better help you in the gym. And watch more episodes. There's a couple of podcasts that I'm on where I talk about pelvic health, get more educated about it, but start to talk about those things. I don't think the first question you should ask is like, hey, do you have pain with sex? Like, how's your sex life? Don't talk about that, but you can start to kind of approach it with those things, build a rapport, and then you can start to get into it too.
Yeah. So the going forward from there, obviously one of the groups of people that you mentioned when we were talking before is people that have had C-sections.
Mm-hmm.
I'm assuming that it's ever more common now than it's ever been. So what are the dealings? Because I know when we work with women who come in after C-sections, a lot of them ask the same thing. It's like, can you help me with this like little pooch that I have here? And I have to explain to them that like sometimes, and I'll let you describe it even more in detail. Like, that's not a fitness problem, right? There's nothing to eat and there's nothing to do training wise to help with that. Sometimes it's scar tissue with working with a therapist can help. So what are the main concerns or things to kind of look out for, for the women that have had C-sections or certainly if they've had multiple C-sections?
That's a great question. C-sections need a lot of attention. And the problem is, when you go for your checkup, doctors will say, don't lift anything over 10 pounds for, 8 weeks, and I'll see you then. Mm-hmm. And your baby weighs close to 10 pounds, or you have, a 1 or 2 year old at home. So not great advice. When you have a C-section, it's a major abdominal surgery. And so the advice that I'm going to give is for any other major abdominal surgery you might have had. So again, I see people with all kinds of, hysterectomy, gallbladder removal, hernia surgery. So all of this advice goes with that. You need to always work on the scar. So when you have a scar, yes, your body lays down scar tissue, and that's not a bad thing. That's what it does to repair itself. But I always like to explain scar tissue like Play-Doh. And if you don't work it, if you don't knead it, it's going to just get stiff and dry and not be like we need it to be. So you need to work on your own scar, and you can do that kind of over the top, over the bottom, on the sides, using a little bit of lotion, and not just on the scar, but also across your whole abdomen. So your abdomen's like those shirts that if it pills in one area, it can pull in another area. So there's this fascia that crosses that really needs to be moved when you've had a scar that's kind of cut through that abdomen. So you want to massage your stomach and get some good blood flow there. And then you need to work on your lifting mechanics when you go back. So, 8 to 10 weeks after your surgery is when your scar is the strongest. And then you want to start to work on bracing techniques again. So that's where coaches can do a good job of teaching them good strengthening for the TA, the obliques, the rectus, and just like you would, any post-surgical recovery. So you start with just general activation, and then you start to load it. And that's probably what I would recommend for C-section scars.
And then for women that are going through pregnancy now and they are pregnant, are there things that they can be doing kind of proactively to try and, I don't know if minimize is the right word, but to kind of minimize the damage or effects that going through pregnancy will have? Are there things that they can be doing with their own training or at home routines to kind of help, help them rebound a little bit faster?
Sure. There's a lot of things they can do before they even become pregnant. The stronger that you get your body, the more mobile you get your body, the more ready it will be for pregnancy. Pregnancy is a big deal. So you want to talk about load, like you're loading an extra, 20 to 40 pounds on your pelvis. So the stronger that you can get your hips, your glutes, your inner thighs, your core before. And the more, again, hip mobility, hip rotation you can get, the more space you have in your pelvis and the more support you have. And then once you are pregnant, I'll see women through their entire pregnancy, and we really, again, continue to address mobility and strength, and then relaxation of their pelvic floor, because their pelvic floor is being loaded from above all the time. So a lot of times we use a wedge to invert the women a little bit in the afternoon, which helps give the pelvic floor a bit of a break. And then there's a lot of manual work that we do to the pelvis, to help with blood flow and recovery. Some women have heard things about like perineal massage, and that is super awesome, and that helps prevent perineal tearing during childbirth. And then when it actually comes to childbirth, there's exercises you can do to help open up the pelvic inlet and outlet so that you're minimizing damage on these muscles. So these muscles are incredible. They're expanding during pregnancy, and they're going to do their job. And the more that you, again, stay mobile, stay strong, continue to move, the better it is. And then as far as nutrition, making sure that you're supporting yourself in that way and with hydration, then these women are very successful during pregnancy.
Cool. And I want to be clear too, like, for women out there, like, I don't think you need to be superwoman when you're going through pregnancy. I'm looking at it more from like a preventative care. Like, how could you, help to kind of improve some of these things. And taking time to come back afterwards is obviously super important as well. So we spent a good amount of time talking about women, but I think one of the, we had spoke about it before we started, more of the underrepresented or people that are even more kind of uncomfortable about talking about some of these things are the men. So, what are some of the aspects or characteristics or symptoms and what men end up coming into your practice, and how are you helping them?
I'd say there's two groups of men. So there's the older men who are coming to me after or before prostate cancer, prostatectomy, radiation.
Mhm.
And so they're having a lot of incontinence, which is urinary leakage. And so I help them. And interestingly, a lot of them their pelvic floor is pretty strong even after all that radiation and that invasive surgery, but they end up being really weak in their lateral column, their obliques, and their glutes. And so we're actually in the gym most of the time doing a lot of strengthening. So, when you strengthen the pelvic floor, that's called a Kegel. And I'd say 95% of people who come into my office are doing it wrong. But I'd also say that a lot of people do have good strength in their pelvic floor. So you'll go to some PT offices, pelvic PTs, and they'll just hook you up to a biofeedback machine and you'll be doing Kegels all day. And that is not very useful in your body system. Only a few people I see truly need that targeted pelvic floor strengthening. It needs to be more functional. So these guys were out in the gym and we're doing a lot of cross training, like I said, and they do excellent. And then their incontinence goes away within a couple of weeks, which is really awesome. And then I'll see a lot of younger men, and we're talking, I have a 18-year-old, 18 to probably men in their 50s, and they deal with a lot of pelvic pain. And that can present as groin pain, hip pain, low back pain. Sometimes it just presents as testicular pain, penile pain, burning in the genital area, pain after sex, things like that.
How do they end up kind of coming into your office? Is it just they've seen the regular physician, they've seen other physical therapists for certain issues? How are they escalating up the chain to kind of make their way to seeing you?
Their urologists will send them. So a lot of the urologists in the area know about us and know that we can get people better. So they usually get diagnosed with something like prostatitis, which is not the proper diagnosis.
Like impingement. It's like,
yeah. So, and their prostate might be enlarged, but that's not what's causing all their pain. So they come to me from that referral. A lot of times they're just Googling online and searching for answers. And now at least the internet, I think, is a little bit better and showing that these things are connected and they're coming that way. But honestly, men, it takes them a lot longer to come to me because they don't think that I can help them. And they don't really see the connection of, if it's their groin, their low back, they don't understand how their pelvic floor is connected. They see the pelvic floor as a women's issue. But, everyone has a pelvic floor. So once they get to me, then everything is good and I can show them how everything is related. And then they really start getting relief and fixing the actual problem. But it is a struggle to get people to actually come in and find the right answer.
Yeah, I think that's why the avenue, at least into the weightlifting and powerlifting community, is a little bit easier because at least people that are lifting there get the idea of building up pressure in your abdomen and how you're using that to create more force. So, last thing I want to talk about is because I think what you touched on everybody assuming that they just need more pelvic floor strength is one of the more common things that I know I hear as just a health and just as a fitness professional is they kind of come in with now I know, like I just got to get it stronger. Um, and the point that you brought up was, hooking you up to a biofeedback machine for anybody who's listening who has no idea what any of that means. Basically means think of it as like being able to see on a computer what you're doing and if you're using the right muscles and how hard you're exerting. So you sit there and do this Kegel exercise, you watch, generalizing here, a little meter go up and you're like, oh, look, you're doing it well and we need to get it stronger. But sometimes the issue, and this goes for a lot of places in your body, is that the 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 stabilizers aren't meant to be prime movers, right? And when we're training them to do that, sometimes we can be creating even more issues. It can be making things worse. Does that relate to same? Am I phrasing that correctly in terms of like, at some point they're strong enough, and it becomes what are the things around them doing? Why it shouldn't be taking up that much of the work?
Absolutely. So if someone's coming to me with incontinence, we haven't talked too much
Mhm.
about that. So if someone's having problems with their bladder leaking, and that I think I didn't even bring up that as a problem with your bladder. If
Mhm.
your bladder is leaking at all during any part of the day, you need to go see a pelvic health therapist. That's not just because you're getting older. That's not
Mm.
because you had kids. That can be easily fixed.
The best way I describe that is trying to explain to women there's a difference between something being common and normal. It can be
Correct.
super common, like, oh, it happens to a lot of women. It's common. It doesn't mean that that is normal and we shouldn't do something to address it. Right.
Absolutely. And so when someone comes in with that diagnosis for me, there's a million different um, ways we can get them better. Now, sometimes when they're coming in with incontinence, their pelvic floor is weak. It does go through a lot with childbirth, and sometimes it does need proper strengthening and just proper activation because people, especially with nerve damage in that area,
Mm.
sometimes women or men don't know how to activate that area. So absolutely, that would involve doing some strengthening there and then making it more functional in the gym, working with some of these bigger muscles. Sometimes when you're having incontinence, that actually can be from your pelvic floor being too tight. And when your pelvic floor is too tight, it can actually push on the bladder and make the pressure so much that you start to leak. Sometimes it's from hip tightness. Sometimes it's from constipation. Sometimes it's from, that C-section scar is putting added pressure down on the bladder. So it could be for so many different reasons, which is why, as a coach, if a woman is saying, oh, when I jump rope, I leak a little bit. You can't just go say, well, all right, well, just go do your Kegels at home, come back, and we'll get you stronger.
I know that we talked a lot about pelvic health, but you also you see clients for regular orthopedic issues too, as well, right?
All the time. Especially, I love chronic pain. I love people who, their body has been through a lot and they haven't been to someone who takes a look at their entire body. We have so many knee specialists, hip specialists, low back specialists. And there's been a couple of stories too when people come in with some pelvic problems or bladder issues, it's literally from their ankle.
Mm.
I had one woman who had a stroke and then she was having all of a sudden a lot of urinary urgency and going every 30 minutes. Because of the stroke, her left ankle, she couldn't lift it. Like the 8 to 10 degrees of
Mhm.
dorsiflexion that you need to clear the ground. So because of that, then her gait progressed where she was hiking up her hip on the one side all the time. And then if you keep continuing to do that, those hip muscles can get tight and then press on the bladder and then cause the urgency. So she was someone where we actually had to do a lot of ankle work, ankle mobility, ankle strengthening. I didn't even touch her pelvis the whole time and her bladder got better.
I bet you
So
that was fun for whoever does your insurance submissions. Why you were working with someone's ankle when they came in,
yeah.
for incontinence or whatever her main issue is. Um, and that's a topic for a whole different podcast. But yes, I know you probably struggle a lot with. There's not everybody's gonna be open to that, right? I think sometimes it's like I'm here. My doctor gave me this script for this thing, so I want you to work on that thing.
Right. I'm here for
And
my knee. Please work on my knee. I was like,
right,
okay, I know you're here for your knee, but you've been having this knee problems for a lot of time. Do you know what's causing the knee pain? So I like to identify root cause when people come in, and I spend a lot of time trying to identify that. And that could be, again, a lot of times it's from how you move throughout your life. And so we're trying to look at that and even out your body a little bit better.
So, funny story about that though, to just, if you are going to see Tamra and you go to her website, make sure that you download the correct intake form, because I sent a client to Tamra one time for her shoulder, and I don't think that she looked at that there were multiple intake forms, and she
And she did the
texted me,
pelvic.
and she texted me on the side and was like, "Hey, Brian, like, I mean, I'll answer these questions, but there's a lot of like pain with sex. Like, what? No, like, not that I know of, or like, why is she asking me about like if I'm constipated or what, what direction my pee is going? Like my shoulder hurts." So there are two forms. All right. So if you're going for an orthopedic issue, fill out the orthopedic form. If you're going for a pelvic related issue, fill out that form.
Absolutely.
So important to pay attention to that there. Now a little bit more about you just personally. I call Tamra the most, she's the Dos Equis woman. She's the most interesting woman in the world. In your office, you have this huge map, right, of all the places that you've been. How many different, so for reference, it's summiting the highest peak in each area that you go to, right?
Yep.
How many do you have now?
So I'm a high pointer. I like climbing the highest mountain in each state, in each country. So states, I'm up to 48. I almost finished, but I had to turn around 3 hours from the top of Denali, which is the highest point in North America. Because I actually passed out from heat exhaustion in negative 60 degrees because I dressed too warm for the day. So I am aching to go back there probably in the next year or so. And then I want to finish. The last one I have is in Utah, and I'll do that with a bunch of friends. And then I think I'll be maybe the 35th woman to do all 50 high points. And then now I started doing country high points, and I have 30 of them, I think. So about to be 31. I'm going to Bolivia in a couple of weeks to hopefully climb that one a year before my accident anniversary, just to prove.
Oh yeah, let's touch on that, because the world is ironic and weird. And what injury did you have recently last year?
I fractured my pelvis.
Fractured your
4
pelvis. The pelvic.
spots.
Yeah, there you go. So what happened? And I know you posted videos of your recovery. So just take me through that. What happened? How did you get yourself better? What did that look like?
Yeah, I was training to bike from New York to Canada with my friend. We were doing the Empire Bike Path, so it's 400 miles. We're going to do it in 3.5 days. So I was just trying to get more miles under my belt, and I was biking to work to see someone on a Saturday as a favor. And lesson learned. I
Be clear about that.
I don't go in on Saturdays.
Was
anymore.
not supposed to be there.
I think that was the lesson. And a van pulled in front of me like a mile from my house, and I hit my front brakes way too hard to avoid hitting them. So it was probably half and half each of our faults. And then I flipped over the handlebars, landed on my right hip. And I was stuck in the middle of the road for a bit. A cop found me and dragged me to the side. And then, as stubborn as I am, when the ambulance came, I did fracture testing with them. And I was like, oh, I'm fine, because I could stand. Interestingly, I could squat. I could side lunge. I had a negative Faber test. I could, my femur was fine. So I had them bring me home, and I think I just needed to rest up. And then I found out a week later, because the pain didn't go away and I couldn't walk. I couldn't move my leg forward, that I fractured it in 4 spots, but my muscles were so strong that it held my pelvis in place, which is awesome, because I've done a lot of work. I've had probably about 6 surgeries in this area. So, I'm the queen of rehabbing the pelvis at this point. And so it looks like it's working, because everything held together, which is great. It didn't need screws or anything. So yeah, it'll be a year in June.
So did you need surgery?
No surgery. And they said I'd be in the wheelchair for months, and I was walking in 3 weeks. And yeah, it's been a struggle to rehab for a big injury like that, but the pool has helped a tremendous amount. And I've had to learn even more things about the pelvis and how to rehab and recover, and patience, and all the lessons that are very important.
Yeah. And a word of advice or caution to, especially women as they get older, right? Fracturing your pelvis, how old are you?
I'm 36.
At 36, not an issue. Fracturing your pelvis at 66,
huge issue.
A huge issue. So, a lot of this stuff is just like anything else. It doesn't seem like, well, if I don't have any symptoms or if I'm not having issues, why should I be focused on any of this? But good, solid strength training to make sure that your bones are dense and can handle injuries like this is super important to making sure that, you're not only strong right now, but that you can continue to, I mean, I think both of your parents are super active and they're doing
Yeah,
lots of amazing things as well. So I'm sure you had good role models in that regard, but making sure that you can not only live through those ages, but live on your own terms and do the things that you want to do at those ages as well.
Yeah, I want to help people get their bodies prepared for, you know, the next 50 years. And there's a lot that you can do now, and it doesn't have to be big things at all. That's the biggest thing I've learned over the past 15 years. It's the small things that matter. We actually just did a Minute Matters campaign in January on our social media because a recent study came out where 2 minutes of strength training did just as much as 15 minutes of strength training. It was a shoulder study, but the lesson behind there is I have so many people who throw up their hands are like, and I'm guilty of it too. Oh, I don't have the hour to do my really fancy leg workout. That's it. My life sucks. I'm working too much. I don't have time for myself. You have 2 minutes to do, a couple of different exercises. And that's what's really important. Consistency is what's important. You continue to be consistent, 3 days a week for a few minutes. That's going to add up over time. Compound interest, all things that we continue to talk about. But I really saw that after this accident, it made a huge difference that I did everything that I did leading up to that.
Perfect. So to recap, what are, if for advice for people that maybe can't see you or might be listening and they're wondering what they can do, what are like 2 or 3 things that people should be kind of focused on to make sure that they're taken care of, either on like a daily or weekly basis that can help them in this realm?
I have great resources for this on our YouTube channel. So I would say run through my Happy Hip Mobility. It's 6 exercises that I take people through. It's usually how I evaluate people to see where they're lacking in mobility. So do those 6 exercises, star which ones are the most challenging for you, and start focusing on those in your everyday life and doing those a couple times a day. Make sure that you have really good hip mobility. That's number 1. And then I have 3 hip strengthening videos on there as well, also called Happy Hips. So those are good things that you can do to start to strengthen your hips, especially in the lateral position, because we don't spend enough time there. So I would say hip mobility, hip strengthening, 2 of the biggest things that I promote. And then we have got great resources on there for like abdominal massage and other things that you can do to evaluate your own body, making sure that you have good bowel habits and you're going to the bathroom 1 to 2 times a day. You do all those things and your pelvic health should be in good shape.
Well, Tamra, it's great having you on. Hopefully this podcast is eye-opening for everybody to take a deeper look into these issues, maybe get them more aware of some symptoms and things like that we haven't, and also make it a little bit more comfortable and feel like they can reach out or ask questions about these things. So if they are looking for more information, where can they find you from a business standpoint and also from like a personal standpoint?
Yeah, so you can find me at Inner Dynamics Physical Therapy. Our main office is in Ocean, right by Wegmans. And then our other office is in Toms River. And I have a team of, a lot of therapists who are happy to help you with all your problems and kind of work on your body issues. And then you can also find us at innerdynamicspt.com. And please also follow us on social, on Instagram, Facebook, and YouTube, because we're constantly uploading content on ways you can make your body stronger and more mobile so that you can stay healthier throughout your life. And you can also follow me personally on Instagram at Alpine Addict and see if I make it to the top of Bolivia.
All the Dirtbag High Point travels.
Yes.
Every time. Thank you.